Okay, while we are rearranging a little bit the setup to ensure we can all see the presentations, let me welcome you all. Good morning. Welcome to the session on food systems, nutrition and climate, where we will explore opportunities for local collaboration to unlock finance at this critical convergence. My name is Irina Zodro. I'm the head of Partnerships, Financing and Network Relations at the Scaling Up Nutrition Movement Secretariat. The Scaling Up Nutrition Movement, or also called SUN, is a movement of 66 countries, 11 of them here in Asia, bringing together diverse coalitions of governments, business, civil society, academia, youth, donors, the UN, and many other partners, including the international financing institutions. Together with my colleague Edward Burdell, who is with me, is our food systems advisor in Geneva, and Amaka Odenigbo, who is our country action specialist in our regional office in Bangkok. I'll be moderating the session today. From the start of this forum and at the highest levels, we have heard about nutrition as a key driver and critical outcome of the food systems and agriculture transformation that we so badly need. We've heard about the global readiness and commitment to nutrition as part of the declarations of food and climate and health coming out of the COP28. On the flip side, we know that from a financing perspective, while there has been an increase in global investment in food systems transformation, investment in nutrition is lagging behind other dimensions of this transformation. This was highlighted by the excellent analysis by IFAD and the World Bank, both partners of SUN, and other partners through the Tracking Financial Flows to Food Systems tool, which was presented on Tuesday. And as we will hear during the panel, this is repeated through climate finance. As a country-led and country-driven movement, we at SUN were also keen to understand how these dynamics are playing out at local level, and also to understand the opportunities that exist for new collaborations that can unlock financing for nutrition across climate change and food systems transformation. So to do this, we have an excellent panel that will speak to us today and give us good ideas from the country level. The session is divided in two parts. First, we will start with the panel session and followed by a, so to speak, more traditional questions and answers that we mix with an opportunity of interaction between the panelists. So you will see that we will ask some questions to you, and we really hope for active engagement from your side. So without further ado, I would like to invite our panel to the stage and introduce them. Maybe we do this while I introduce you. I have to find the right points. So today we have Dr. Azucena Dayan Hirang. Yeah. Easier for me, also called and well known under her name Dr. Apet. She's the Assistant Secretary and Executive Director of the National Nutrition Council of the Philippines and SUN focal points in the Philippines. We also have Ms. Regina Nukunj, Senior Food Security Policy Officer at the Department of Agriculture and Livestock in PNG. We have Dr. Xin Long, Principal Social Sector Specialist at IDB. We have Ms. Sherry Attilano, Founding Farmer CEO and President of Agrea Agriculture Systems International Inc., a for-purpose and inclusive business. And Sherry is also a member of the SUN Lead Group. And we will be joined online by Jessica Colston, Lead of Environment and Nutrition of GAIN, another important partner of SUN. So with this, I would like to invite the panelists to come up to the stage, please. Okay, Dr. Appet, may I start with you? So, from your perspective, as Executive Director of the National Nutrition Council, can you give us some example of how the government in the Philippines is addressing the interlinkages between climate change and nutrition?
Thank you very much. Irina?
Whichever you like. It depends
All right.
on...
Just like Dayang Hirang, the Dayang Hirang. All right. So before anything else, I'd like to greet everyone a pleasant morning, before lunch. And then I'd like to thank ADB for the invitation, because this is a high opportunity for us to discuss the country's perspective on the critical intersection between food systems, climate, and nutrition. Well, to go directly to your question as regards to how the country is addressing the intersections between food systems, climate, and nutrition, and who are the key actors then. Okay, so actually, the Philippine government has been prioritizing climate adaptive interventions as embedded in the Philippine Plan of Action for Nutrition. This is the country's framework for nutrition actions. So today we have a new PPAN, so the Philippine Plan of Action for Nutrition. This is a multi-sectoral, multi-level, at the same time direct plan of action for nutrition, for where stakeholders can really take a look at it, being the guidepost or the blueprint. Now, what are these examples? But actually going to the key actors at the national level, we have our Department of Agriculture, of course, being the co-chair also of the National Nutrition Council Governing Board, which is the highest policy-making body on nutrition in the country. And at the same time, we have also the DILG, or the Department of Interior and Local Government, and the Department of Environment and Natural Resources. We have also the DTI, the Department of Trade and Industry. At the same time, we have the Department of Science and Technology. Now, these national government agencies are actually very instrumental in crafting policies and programs being implemented at the local level. So the programs are aimed at promoting sustainable, healthy diets, at the same time advocates for, behavior change as a critical key towards sustainable, healthy diets and really improved nutrition adequacy, especially among our affected population on climate change. So specifically, what are those interventions that are embedded in the Philippine Plan of Action for Nutrition? First, we have the provision of systems and technologies for our farmers, for our fisher folks. No? So, and at the same time, we have distribution of inputs, farm inputs. This is to reduce post-harvest losses, at the same time, increase food production, thereby increasing food security in the country. And at the same time, we have also the provision of easy, adequate, and affordable credit programs for our farmers and fisher folks, and at the same time, smart agriculture. So these are all the necessary interventions that are embedded in the new PPAN. And at the same time, we have also to strengthening of our research and development component in such a way that the Department of Science and Technology are making it a point that healthy diets are really being propagated through commercialization of the modern and new production technologies. So at the same time, what the government is doing is that all the new technologies of the Department of Science and Technology, which are the healthy diets, especially complementary food for children, are being procured by the three big agencies of the government. In particular, my agency, though small, we have what we call the Supplementary Feeding Program, which our national government is offering for the first 1,000 days. That's under the National Nutrition Council. And the life stage approach, so first 1,000 days from pregnancy up to 2 years of the child. And then second is we have the supplemental feeding program by the DSWD, or the Department of Science and Welfare and Development, wherein they cater to children 3 to 5 years old. And for continuity, we have also school-based feeding program for school children. So that's DepEd. So we will be tackling about additional, as they say, not only the first 1,000 days, but we have also the continuing of the 7,000 days, meaning to say 19 years old, because we know for a fact that hunger among our college students, among adolescents, are also very rampant. So these are all the interventions that in a way can help our farmers and fisher folks that really are impacted due to climate change. And for the information of many, the Philippines is situated in the Pacific Ring of Fire, wherein many volcanic eruptions, typhoons, and earthquakes occur in 1 year. So with this, we have to, climate responsive, we have to be resilient enough in order for us to really cope up with the disasters and other calamities that hit our country. That would be all.
Thank you, Dr. Abed. It's always exciting to hear about the Philippines and its lead role on multi-stakeholder, multi-sector, and the national to local. And I personally also very much like your life cycle approach, because I think adolescence is especially one area that is often overlooked, and it's a critical area for us to enhance action. So with this, I would like to turn to Jessica, who, as said, unfortunately will not be able to join us today, but has sent us a video overview on the ICANN baseline. ICANN is the international initiative on climate and nutrition. It's been launched at the COP27, and it's together with the government of Egypt. So here we're going to see a baseline which looks at the interlinkages between national nutrition plans, national determined contributions, and national action plans. Jessica, please.
Hello panelists, dear colleagues. Thanks so much for having me at today's session and to talk to you a bit about the initiative on climate action and nutrition and how we're contributing to this work to connect nutrition, climate and food systems. I'm delighted to take a bit of time today to introduce ICANN to you and also speak to some of the research we conducted last year that looks at how integrated nutrition and climate are across several areas, policy, but also across finance, which I know we'll be discussing today. So to get straight into it, I wanted to start with what is ICANN. This is an initiative that was launched by the government of Egypt at COP27, and we've been busy over the last 18 months developing our thinking and really trying to advance how we can take forward the climate and nutrition agendas together. GAIN is delighted to co-chair the working group, which sits under the Alliance for Transformative Action on Climate and Health alongside the Government of Egypt, and we work very closely with our partners WHO, FAO, UN Nutrition and SUN on this work. As you can see at the top there, the goal of ICANN is really to support action to improve climate and nutrition outcomes at the same time. So the premise is around, we have these two really important agendas, really important areas where we know we desperately need to take action and fast. And by looking at them together, we have the opportunity to move faster towards both goals because they're so deeply connected. So that's the premise. How can we integrate and accelerate action? Where we started from is to really understand actually where are we today and what do we need to do to advance those joint actions. So last year, as you can see on the screen, we published 2 reports, one which really looks at those pathways to impact. So what are the actions we can take which help us to address climate and nutrition together? And the second is an analysis of where we are today. So looking at these different policies, looking at things like the nationally determined contributions, the national adaptation plans, national nutrition plans, but also finance, both overall in terms of ODA, but also from individual institutions like the GCF and the World Bank. What do we see at the moment in terms of what's happening for nutrition and climate together? So that's the second report you can see on the right there, where I'll be spending a bit more time sharing some of the results with you and hopefully highlighting a few areas where we could be taking action in the future. So for this analysis, we didn't just look at whether climate and nutrition are mentioned in the same financing grant or in the same policy, but we looked at how connected they are. You can see lots of areas where perhaps the concept of climate is mentioned in a nutrition narrative or vice versa. But where we only saw that mention without the kind of concrete action to back it up, you can see that we distinguish that as a level 2 compared to where we might see these really concrete plans to take action, for example, at level 4. So as I share these results, you'll see these different levels referred to, but the idea is to really measure the depth of integration. I'll cut straight to it. As I think you won't be surprised to hear, there is a significant lack of integration between nutrition and climate action. And we saw that kind of pretty much across the board. So when we looked at nationally determined contributions, countries' climate commitments, we saw that only 2% of them have concrete plans to take action to address nutrition at the same time. However, when you look at commitments on the nutrition side, so for example, those made as part of the Global Nutrition Report, we saw that 95% of those also did not consider climate or sustainability. To get into a bit more detail on some of the themes from those results, we saw quite a lot of differences across different regions. Looking at Asian and Pacific countries, we did see more mentions of nutrition in NDCs, but that might not have involved the level of commitment and action we saw in some other regions like Latin America and Africa, where we saw even more commitment to integrate nutrition into climate policies. Similarly, something we found really interesting was that food security was much more likely to be mentioned than nutrition, particularly in these climate documents. I think this is a great point to pick up perhaps in our later discussion today, as obviously food security is an important goal within itself and an important prerequisite for good nutrition. But we felt as we looked through, there was potential to increase the explicit role of nutrition within these documents as well. Then coming to finance, I was really interested to hear that Joe Puri from IFAD shared some new research earlier this week, where they have seen the overall amount of funding from ODA towards food systems rise. I think what we want to highlight here is how little of that is explicitly mentioning nutrition. When we look for those explicit mentions, we see that there's only around 1% of total climate-related ODA that's going towards nutrition goals. If you look at a slightly wider set of keywords that indicate kind of food system sensitivity, nutrition sensitivity, we can see that that's potentially a larger pool. But again, I think it raises the question of how we can best target nutrition explicitly within this. A final result to share with you is around public procurement. I think this is a really key area where there are opportunities to provide both healthy and sustainable food in public settings such as schools or hospitals. But we saw when we analysed the database of public procurement policies that WHO has available, almost all of them, 83% of them, made no connection to climate and sustainability goals. So I think this is a really promising area for us to look to connect the two agendas. So I think I've given you a picture overall there of a few different things related to how connected nutrition and climate are and where we might have opportunities to explicitly strengthen nutrition within them. I want to take a very brief look forward at what some of those opportunities might look like. We know that there are opportunities across multiple pathways, and I've borrowed this from the second ICANN paper I mentioned at the start of this intervention. But I want to say it's not just about food in relation to climate and nutrition. We can also consider interventions through health systems and health pathways, but also through things like water systems and social protection systems, where there are also these connections between nutrition and climate. And I hope my panelists coming after me can help to illustrate that further for you. And finally, I just wanted to leave you with this quote from the foreword to the report where I've been sharing this research from you. This is from two ministers from the UAE and the government of Egypt in their respective roles as presidencies. And I think this really emphasizes to me what we can do. Bringing these two forces together really gives us an opportunity. It's invaluable in showing us what we can do to improve integration and accelerate action. And I think that's really why we're all here today, to look at why we can address nutrition and climate together. Thank you.
Thank you to Jessica, who, as said, was unfortunately not able to be here today, but her colleagues from GAIN India are online and ready to give further details and engage in the discussion later. So with this, I would like to turn to Regina. And maybe, Regina, because you have also a PowerPoint, you would like to take the podium. So Regina will share with us. Regina, can you tell us about some of the information needs that countries have to inform policy and design programs on food systems and nutrition from the perspective of Papua New Guinea, please? Thank you.
Good morning, everyone. Thank you to your NOPS, Edward, for the last minute to put me on to speak. It is a very passionate subject. And so I just have, for those that have attended yesterday's afternoon session, where I presented on the partnership and on the information gaps in the country. There probably I borrowed some slides from there, so it may seem repetition, but I'd just like to stress on the partnership that is very important to addressing many of the challenges that we face in terms of working towards mitigating climate change in agriculture, food security, and addressing our nutritional needs. So, just before I can, I just leave that slide on, and I just want to give a few, issues that we face in the country, and one of those very high rate, we have the highest rate stunting in our country, in the region and the world, and undernutrition. And almost half of our children under 5 years old in PNG are stunted, meaning they are shorter than expected for the age. High levels of undernutrition persist, affecting child growth and development. Anemia and micronutrient deficiencies also is an issue that we face, and we try to address through the nutrition specific, providing supplements to the pregnant mothers and iron deficiency children. Also high levels of overweight and obesity. These are, I think you can see it's across the Pacific. We also have diet-related non-communicable diseases, diabetes included in obesity. Also challenges in implementing though we have a national nutrition policy, which was from 2016 to 2026. We had an action plan, but they 5 departments, so across government agencies, were part of the signatories to implementing the action plan, and that included Department of Agriculture, Livestock, Department of Health, Department of Community Development, and Youth, Education, and the National Department for Planning and Monitoring. That's the department that oversees all the policies, national policies and plans in the country. So these are the 5 agencies that have signed to collaborate to implement. But from 2016 to 18 and up to date, with our health capacity being so very low, and with so many other diseases, and especially the COVID in the last 2020 to 21 and 22 after effects has really put a stress on our health system. And so we try to address those issues that are related to, for agriculture, we try to address, people getting back on their feet after COVID. And Department of Health is trying to get themselves, prepared should there be another bout of COVID. So with all of that, it's a big, very big challenge at the country level. And with these challenges, partnership, I'd like to stress that, medium and long term is key to implementing and also building and sustaining our data or information systems we have in the country. As a background to Papua New Guinea policy makers, it's really a nightmare to work with scarce data environment. And some of those, like with our agriculture, we have yet to do a national agriculture survey or census. The last one we had was in 1961, and that is like 50 years. Then we had household income expenditure survey. That is just to give, status of the people on their income, the status of their health, the status of how they can cope in terms of, having to buy the additional protein should they have to be able to have a balanced diet. And that the last one was done in 2009. Then we had National Nutrition Survey in 2005. So, and maybe you could say the most recent would be Demographic Health Survey conducted in 2016 and 18. So these do provide a gap in information, and as policymakers, it is like expected to have evidence, good evidence to back your policies, and also to feed those information to the decision makers at the higher levels to make good decisions for the people. And another background, that contributes would be that 80 to 87% of our population still lives in the rural areas, and their livelihood is solely sustained on agriculture. And those, we are more, crop-based farming system we have, and protein source would be very scarce at the village level. So then the need for innovative solutions to fill those data gaps. There's also a need for support in building a data infrastructure that is utilized by the government, local research institutes, and development partners to inform real-time policy trade-offs. So given this background, we had this is an example of a partnership that with IFPRI. We have had other partners, but the recent one was with IFPRI, and that is a survey conducted in 2023. And the survey was launched just last month. And this survey is most comprehensive data collected from 14 provinces. We have, we can say, 22 rural provinces, and one would be the National Capital District, which hosts the capital city. That is also considered as a province. So, but otherwise, we have a total of 22 rural provinces, and 14 of those was in the survey with 270 communities. And this was, we took it as one of the recent survey for the household. The last one was, like I mentioned, was 2009. Though this may be not considered as a whole national, data, but it is something that gives some information to at least work on. The survey data is being used already to inform planning documents of different government departments and agricultural development programs, and ongoing capacity strengthening on data analysis and simulation modeling to inform important policy questions. So you can download this recent report that was launched last month with the given QR code on the side there. So I just want to conclude. Very strong partnership and investment is the way forward to address nutrition and nutrition needs in the Asia-Pacific region. IFPRI has integrated a strong capacity strengthening element to their program that has had some important impact for our programming. During the recent large survey, IFPRI trained 80 enumerators to use tablet technology to collect data. The National Statistics Office of PNG is now using those enumerators trained as survey supervisors for our upcoming census. The preparations was last year, and this year they're going to start conducting that population census, national population census. We have used the survey report launch to strengthen collaboration between our government, Department of Agriculture and Livestock, the Department of Health, and the Department of Health. You know, during the survey launch last month, it was really good to see the two heads of the departments in the same room, and they really embraced the report that was presented. They saw how important agriculture is to nutrition and health outcomes, and have since planned further interaction to have a better cross-sector approach. Since 2018, when IFPRI did their first smaller household survey, there has been a shift in government to focus more on food security and agricultural linkages to nutrition, such as incorporating nutrition-sensitive initiatives with cocoa and coffee farmers. And that is ongoing too. In order to collect the data on child nutrition indicators, IFPRI worked very closely with University of PNG and the Department of Health to train the enumerators properly on how to measure children. They are now working with the university to analyze the data, and recently gave a presentation at the grand rounds in the medical faculty building. Our new collaborative work will be on updating the PNG National Food Security Policy. That will be reviewing one that we had done in 2015. Thanks to this forum, so forums such as this is a great start for informing opportunities for future investments. Thank you.
Thank you, Regina. So after we now also heard from our Sun Country lead from the Philippines and the Sun Country Papua New Guinea, I think it becomes very clear why Sun is a country-led and country-driven movement, because the experience and wealth of information and also the knowledge of the challenges is nowhere greater than in the countries themselves. And I also thank you and also Dr. Appet to showcase how the opportunities for the regional and global partners to then engage with the countries and support progress. So now it's my pleasure to invite Dr. Xin Long from the ADB to give us her view of opportunities, especially with regard to supporting the financing for the countries. So Xin Long, how is ADB working in this space, in the climate, nutrition, food systems, and what do actors at national and international level need to know about working with multilateral financing institutions? Thank you.
Thank you very much, Ms. Arena, and thanks for the invitation coming to the workshop. I would like to say that I'm coming from the Human and Social Development sector group in the ADB and taking care of the East, Central, and West Asia region. And we have an ongoing result-based lending for Pakistan in its Integrated Social Protection Development Program, started from 2022. So I would like to share the demand-side support for driving up the support for health and nutrition. Although it's still an ongoing project, some operational review could already reveal that the program has added like to the well-being of the women and children benefited from this Benazir income support program in Pakistan. Basically, the nutrition status in Pakistan has not been that satisfactory, even compared with the South Asian neighboring countries like Bangladesh, India. So we can see that the latest nutrition survey that was done in 2018 revealed that 4 out of 10 children, 4 out of 10 people are stunting, and 1 out of 3 children underweight, and more than half of children are anemic. And it's more severe in the rural areas and in the lowest wealth quintile. We would like to see that, yes, like the government, starting from 2020, initiated this National program that is for the health and nutrition support for the targeted poor households, lactating and pregnant women and children up to 2 years old. It started with 14 pilot districts, and with the recent expansion to almost nationwide. Of course, one of the contributors is the ADB's RBL for this government program. I would like to share that, just to share this setup of this implementation arrangement with the BISP as the executing agency, and with these provincial health departments as MOU partner, who will be providing this venue for facilitation centers, and their health sector workers for supporting. And there is also involvement of different implementing partners. The main players on the field are World Food Program, who is engaged by the BISP to operationalize the facilitation centers and taking care of all this registration, serving, and reporting on the eligible beneficiaries as well as the enrolled beneficiaries. And behavior change and communication have also been taken care of and supported by the UNICEF. Then this conditional cash transfer has been handled by the commercial banks engaged by the BISP to pay directly to the beneficiary women through these biometric POS. Of course, development financiers like ADB, like we are handling policy dialogues, and also the financing through verified achievement of the predefined results by the executing agency. So for example, like through our policy dialogue, BISP started with this climate change responsive, policy work, because BISP has not yet any previous policy on considering and integrating climate change in its social protection schemes. So starting from 2022, with the ADB support, the study has been going on, and some trainings have been provided, like to the BISP decision makers and also their staff. Still, we can say that according to even Ms. Jessica's presentation, like the country right now may already reach the level 3, but before it can step up to level 4 in terms of the readiness of connecting climate change to its support for food security and nutrition. So these are the benefits for those enrolled beneficiaries, and we would really highlight that there is a more support, like for women lactating the female children. Yeah, so this conditional cash transfer amount is higher for families like with girl children. Okay, then the specialized nutrition food. I also noted that about this procurement practices, that is done with the WFP, but locally assembled and distributed. And behavior change has been governed by the updated strategy of the BCC. And we are going to say that this program really, these are the photos that, you know, ADB mission, mostly ADB mission took, like during the review of the program implementation. So the very first left upper is the entrance, at the entrance of the facilitation center. Second, upper left is for the registration, in the facilitation center. And then the third is to show this, it's an in-time machine, provided by BISP to the facility center staff to register and monitor and report on each registered beneficiary. And the fourth one is showing when the lactating woman bring her child to the facilitation center. I mean, the child will be measured with all these head dimensions and length, weight, and all this, while they are taking this awareness raising and the behavior change training. And then we also show this food sachet stored in the facilitation center that need to be kept at the good condition. And then, of course, with the conditional cash transfer as well as unconditional cash transfer, the beneficiary women could really approach to get more food supplies. So these are the findings from operational review and the positive and also mixed picture of the effects. There is substantial increase in spending on children. And also expenditures on non-food items decreased. But expenditures on fruits and vegetables also decreased. That is unclear yet for us to know why. Maybe it's better to understand this food consumption pattern, before and after the intervention. And gender parity is really achieved. You can see that for girls, there could be even 2% even higher than the boys. Also from the feedback of health workers and from community workers and from beneficiaries, they see this increase in the access to health services. We would like, here I may have to skip, for the time purpose, just to say that BISP has a wide coverage in the country. According to their target, they target the lowest quantile of the households. And I would like to show that more we are trying to do. So firstly, under what we call the result-based lending, it's a financing instrument between ADB and our developing member countries. And the social protection is a very good, very suitable sector, to promote government to undertake performance-based budgeting, as well as the robust monitoring and reporting and verification system. So for example, in our ongoing program, we have 3 outputs. So under the output of health and nutrition, we have 2 DLI areas, one at outcome level and one at output level. So outcome level is to measure the percentage of this Nasharuma program beneficiaries' continuous receipt of benefits based on their verified compliance. An output level is the number of the enrolled beneficiaries. We can say that there is not yet any instrument right now can be linked to the impact evaluation that would really come out later after the project implementation. But there will be studies and the evaluation report to be done. So supporting these DLIs, there are different levels of interventions we need to capture in design and monitoring framework, in program action plan, and in technical assistances. So usually this is a basket of support that ADB usually develop in the, proposed to our clients when result-based financing will be pursued. So we will not leave unattended, like our clients, like necessary capacity building, as well as support for independent verification of the DI achievement will be the critical aspects. So we do encourage our policymakers and practitioners in food security and social protection, nutrition aspect, will really consider this instrument. So we would like to say, to explore more, we would like to share these are the areas, the additional financing now ADB is considering on the government's request to add up to the ongoing program. So one highlight is this support for women and children under this National program in flood and drought-prone districts. We are right now doing a quick study on what will be the impact of the disasters and climate change on the nutrition profiles of women and children in those districts. Second is that it is the next stage following our study to support policy work of the BISP is that really there should be some schemes to be developed under this climate change responsive nutrition program. And another thing I want to highlight is this dynamic national social and economic registry. So in Pakistan, BISP and another agency, NADRA, have started this NSER a decade ago with support from different partners, especially like World Bank. So in this year is the time to update the NSER. It's through the wide household survey. And there are like one-stop shop, like set up widely in the whole country, and people can access freely and answer questionnaires. And of course, they have other ways to do that. So in those questionnaires, we are dialoguing with BISP that they need to include questionnaires on what's your, living areas profile under the disaster, climate change, what kind of disaster ever happened to you and what, have impacted on you. Those kind of questionnaires would help BISP not only target families that are under these income quantile, lowest quantile, but also integrate any future impact from climate change on poverty. Thank you very much. If there will be any question, I'll be happy to address. Thank you.
Thank you very much for giving us a very concrete example on how the countries could approach ADB for nutrition investment. And also, I have to say thank you for also highlighting the complexity and the challenges, and again, the local knowledge and understanding that is critical for the success of these projects. So without further ado, and certainly last but not least, I would like to invite Sherry to give us some of her views on the engagement of farmers, fisheries, also women and girls. And I would like to highlight here that I omitted this to both of you before, I'm sorry. Dr. Apet is also the ExCom, a member of the SUN Executive Committee, and Sherry co-chairs the SUN Business Network in the Philippines. And I think this is really valuable right now, because at the end of the day, we will not make this transformation without engaging with the farmers, with the fisher folk, and with business. So Sherry, the floor is yours. Thank you.
Thank you very much, Irina. I don't have a presentation, but Hopefully you'll not be bored listening to me. So I work in the private sector. We're an agribusiness company. So I'm actually trying to share 3 interventions that we're working on as a private sector side, working with the government, working with different private sectors, focusing on farmers and fishers, as well as civil society organizations. So first, our business is into workforce nutrition. I don't know, maybe it's new for you, but in the Philippines, we are the local partner of Sodexo. It's a French company, but we are the largest catering company in the Philippines. Annually, we cater to 8.5 meals for workforce. We work with the largest multinational companies and local companies in the Philippines. So how does it work? Workforce nutrition is actually an initiative by the Global Alliance for Improved Nutrition, also supported by the Scaling Up Nutrition Movement, as well as the United Nations. What we do in the Philippines, though, because Sodexo has been always catering to BPO industries, and Philippines is the #1 BPO industry in Southeast Asia. It contributes 21% to our GDP. But if you go to some cafeteria or canteens of these big multinational companies and digital companies, the nutrition of food is non-existent. Sometimes, of course, it's the economics of the plate, how much per plate to feed the employee. But as a person who works with the farmers, I'm also looking on how do we connect the farmers concretely to the market. So my company used to work with supermarkets and B2C. We used to cater to 75,000 households in the Philippines on a monthly basis. And we transitioned to focus on B2B on companies. So how does it work? We call it Nourishing Workforce, Sustainably Sourced from Well-Nourished Farmers. So we focus on breadwinner. If this person works in BPO or digital company, I don't need to name all our clients, but these are like all the big buildings you can see here in Manila. We cater to most of them. This breadwinner of the family, normally, if they're not nourished in the workforce, especially in the BPO, they work, overnight to cater to international clients. They answer your call, fixing your TV all the way from the US, all the way from the UK. Second one, their only option are 24/7 convenience store and food stalls that are very unhealthy. Third one, Filipino is the lowest vegetable eating country in Southeast Asia compared to Thailand and Vietnam. When you go to them, their noodles is full of vegetables. When you come here in the Philippines, our noodles full of meat and soup. That's it. You barely see vegetable. So how do you see this change, right? And then second one, when you talk to private sector companies, they always see, but the price of the plate, it will be too expensive to add 2 vegetable dishes every meal, right? So what we did is Nourishing Workforce, sustainably sourced from well-nourished farmers, because we believe that our farmers are not only producers, but also consumers, right? So we make sure that when the farmers are connected to the chain, the farmers are also guided on what kind of food they need to buy, because their income is increased sometimes 100 to 300 times more, because there's no layer of trader, they're paid well, and then it's contract growing. So it starts everything with menu engineering. What should be in a plate? So the plate in all our cafeterias are designed on planetary health plate, especially it has minimum of 2 vegetables per meal. So every quarter, we change our menu with 27 chefs, 7 nutritionists that are designing this menu. So every quarter, we know how much vegetables our farmers are planting, how much eggs we need, how much meat we need, how much rice we need. And after that, the design of the menu is based on seasonality of what grows in the Philippines vis-a-vis climate. We have 20 to 21 typhoons in the Philippines, so we need to make sure if there's typhoon in the north, we can source from the south. So in doing so, we have around 37,000 smallholder farmers that our company has been working with around the country. So it's a very complicated scenario in terms of logistics, because we have 7,000 plus islands. We source in more than 1,000 islands to bring it to Manila. We cater to, we bring 64 different kinds of fruits and vegetables. We only import 4 apple, pears, oranges, and grapes because they're not growing in massive volume in the Philippines, or they cannot grow in the Philippines in good quality. But all other vegetables and fruits are sourced and planted locally. So why this is important? We only do not sell fruits and vegetables to our client, all the big guys of the world. We sell them reportorial on sustainability. So here's your vegetables, here's your sustainability report, ESG reporting that you need for your investors, right? So that's how we change the system. Because if you talk to all these big companies right now, for example, the Google of the world, who is also our client, the JP Morgan of the world, they would always say, but Sherry, we want to lessen our carbon footprint. So Dexo in general, by this year, we want to make sure that our carbon footprint is at 34% only, from 54%. So how do we cut 20% of our carbon footprint? And we offer a solution. If your vegetables are flying from all over, this is your carbon footprint. But if your vegetables and fruits are sourced in the Philippines, this is your carbon footprint. So now, how do you see your business? And this is the quality of your vegetables, and this is the price of your vegetables and fruits. And now you can see the economics that is changing, and the decision makers see this. So that's how we do with our workforce nutrition. And in doing so, our farmers are very happy, our fishers are very happy because they have direct supply. And our problem now, they couldn't cope with our demand because now we are feeding 60,000 people on a daily basis, 5 times per day, and this year we are feeding 80,000 people. So we increase by 20,000 every year because more and more companies are signing in. So if you see about financing, it's not like we get cash immediately. It's a business transaction, but this business address the ESG compliance of those big companies. It's sustainable business for us, and it's a very sustainable business for our farmers. And second one, it addresses food loss and food waste. So we measure food loss from the farm to the plate and food waste from the kitchen to your plate. These are two things. Sometimes we say, oh, it's all food loss, but it's two different things. So that's how we do things, and all this measurement of food loss and food waste are also reported as part of the carbon footprint. So in doing so, we create this business, and second one to this is, how do you make sure that the farmers are working, right? For the sake of time, we work a lot with the local government unit where our farmers are. So we form civil society organizations or cooperatives and association of farmers together with the local government unit. So how does it work? We do also another business portfolio. We create an advisory to local government to design their food security and nutrition master plan, where the farmers that we are working with are the direct beneficiaries of the subsidies that the government are giving. Because the problem of the government, we always give to these farmers every year, and they're not sustainable. The following year, they ask for more. The following year, the same farmer asking for more. And if we ask our farmers, they don't have income. Their life is the same. So as we come in, that this farmer has a sure market, you as a government, your help is to support these farmers to meet the demand of the market. So it means the government is so happy because he has a good report from the feedback of the farmers, and the subsidies are also triggered to really productivity. And third and the last component, we're so big in Women Food Producers Association, and this is an all-women panel. Thank you for that. I really need to comment. We work with Women Food Producers Association without alienating the men in the process. We only work with women, it's because they're the best agribusiness people in the supply chain. Despite typhoon, pandemic, the women are witnessed frontliners in our work. So we intensify the work with women food producers. It's because they are the ones bringing nutrition at home. When you empower one woman, and even that woman is pregnant, you know, the baby is healthy, if she's healthy, and then the moment they earn income from our business, immediately they use this income to buy better food, to diversify their land. Because in our company, when you sign up, first rule, zero monocropping. You need to design your land that you have minimum 4 crops in 1 hectare so that you can join our Agria company. And then these women are really beautiful because they create a community of women around them that they support on post-harvest facility and also in logistics. So in total, if you want to change the mindset of how to unlock financing, it's not only coming all the time from the government. Or thank you to ADB for unlocking some support, to the government like Pakistan, but more so the private sector. That's actually why the Sun Business Network is very valuable in this project and also in the work. And lastly, the power of a woman, most especially the power of a mother. Thank you so much.
Thank you very much, Sherry. And indeed, I think we should get the Gender Empowerment Prize of ADB this conference. So I would like to invite the audience to give a warm round of applause to our panelists. I think they shared with us a wealth of information and examples, really directly from the country level, but then also from the global level and the regional level. I think we're getting a bit of a feeling, or you are getting a bit of a feeling how Sun works. And now with this, I would like to move to the question and answer, the interactive section of this session, and I will invite our man, Edward. And I don't know, Amaka, do you want to come up here as well? Okay, good. So I will pass to Edward, who will lead this part of the session. Thank you.
Thank you, Arina. And thank you once again to our panel for your really impressive interventions. That's really, really good to work with you, and also great to hear the examples that you've provided. But as Arina said, we really do want to hear from all of you and give you a chance to hear and learn from one another. So we've got about 25 minutes at the moment, and we appreciate that you probably do want to ask questions to the panel, which you can, but we'd like to start with giving you a chance to reflect and hear from one another. So we've given 2 questions that we'd suggest you think about. The first is, what are some of the other concrete examples from your context at local and national level that have the potential to unlock financing for nutrition, thinking of the forum themes of climate, food and nature? And how can partners work together to make this happen? So I'd like to give you 5 minutes now to turn to your neighbour or the people around you in the room, and to share your pitch or your idea about some of the concrete examples of the work and the bright spots at the nexus that you're involved in. I'll let you know when you're about halfway through this 5 minutes, and so you can hear from the person you're talking to. And after that, we'll invite you to share your reflections, and we'll also give the panel a chance to respond. And if you do have any questions, please feel free to ask the panel. Thank you. Over to you. You have 5 minutes. We're a little over halfway through our time, so we'll wrap up in 1 minute. So if you haven't had a chance to hear from the other person, give them a chance to talk about their key takeaway. So we do acknowledge, and it sounds like from the floor, many of you do want to ask questions as well, so that's also okay. But we'll just come back together now. Thanks everybody for taking a few minutes to chat to one another. And we'll invite you to start making maybe a few short reflections from the floor. Please come up to the microphone if you'd like to talk, and we'll maybe take 2 or 3 reflections or questions, and then we'll give the panel a chance to respond before opening the floor again. I don't need to have a... Can we just ask the text to make sure the microphone is switched on for the audience?
Thank you very much for giving me a chance to share some situation in Vietnam. I am being from the Ministry of Agriculture and Rural Development, and I'm the food system focal point for my ministry. And thank you for the panelists. I very much like the last speaker from private sector. And I think that you should make a connection with Vietnam. You know, we produce a lot of vegetable, and with a very cheap price. And I think we can make the contribute for the food loss and food waste with the value chain, with the logistic arrangement. So I think this is also a good business between 2 countries. And from the last few days to attend the session here within the ASEAN group, we also have the group on the value chain. So I think we should think about that, you know, within the region, within the ASEAN country. So come back to the topic today. Like the previous speaker from PNG or from Pakistan, in Vietnam, we also facing the nutrition problem with the malnutrition for the child below 5 years. I think it's about 20% of the child below 5 years, and malnutrition and also micronutrition and non-disease non-communicable disease. And I think that here's the connection between the nutrition and climate change is the agriculture, is healthy diet, because before in my country, the nutrition is belong to the Ministry of Health, the agriculture product is belong to Ministry of Agriculture, and also the distribution belong to the Ministry of Trade, so it's separately. But if now we also have to change, and the healthy diet is a common place for each ministry also can pay attention to. And in last year, with under the food system framework of the UN, so the government also issued the National Action Plan on the food system transformation in the country, and it's related to at least 4 key ministries. This is the Ministry of Agriculture, Ministry of Health, Ministry of Environment and Natural Resources, and the Ministry of Industry and Trade. And in that National Action Plan, we have 36 main targets, and each ministry also have to responsible. But our Ministry of Agriculture is taking the leading role for that, and we make the coordination among the different ministry. And now we are in the process to setting up the partnership within the key ministry, also with the private sector and with the local authority and the international organization. And we get a lot of support from the UN agency in my country, like FAO, UNDP, UNEP, UNIDO, and as a private sector. In my ministry, we also have a partnership for sustainable agriculture, and like Nestle or IDH or Lavazza or Bayer or some private and also local private also join, and also with the international partner, for example GIZ or SNV or other. You know, when we have the framework there, we organize once a year for forum. So that is the place where we can exchange the policy or priority action of each ministry, and also see what is the different project run by different agency to work together in order to try to overlap the activity.
Thank you. So
yes.
Is that okay, just to give some others? But thank you so much for those reflections in terms of the link to the food systems pathways and food system strategies as well. And maybe when we come back to our panel, it would actually be good to hear a little bit about how that process around food systems is working in your context as well. Is there any, maybe we'll take one or two more from the floor before we go back to the panel. And if you have a question as well for the panel, please feel free.
Thank you so much, and wonderful panel. I must acknowledge that. So much of learning, particularly the practical applications. I come from India. My name is Iram Rao. I happen to be a teacher at Delhi University. Unlocking the finance bit of it, mine is a little different. India has what is called as an Eat Right movement. I have been working very closely with the Food Safety Authority of India. We have one program which is called as Safe and Nutritious Food for All. Under that, we had a PPP model where, since I come from an institution, my strength is students. We took our students to build capacity in government schools. We reached out to about 2 lakh students, where we had only very simple motive, social behavioral change, a soft nudge. You know that the Food Safety Security Network of Government of India, through the PDS system, we've heard about that, the public distribution system is very robust. Having said that, we find that the students do not sometimes consume the meals, and we also have a WIF supplementation, that is iron and folic acid supplementation, as we know that about 50% of our kids are also anemic. What we did was a TOT model, train the trainer. Through the institution students, we went to the school and spoke to them in the assembly. Had a kind of a depiction through a cartoon where we spoke about something like a Popeye show, that what happens when you have iron, how does it take care of the iron deficiency anemia, how it will help them to concentrate, how it will improve scholastic and cognitive performance. And along with that also broke some myths. A lot of girls would not eat these tablets because of some kind of a cultural mindset. They would throw it off. So like every Wednesday in India, they give this particular tablet. So, you know, like you said, you teach a woman, you teach a family, right? So we also worked around that, had games. We never went and lectured over there. So my students prepared a lot of games to engage with them. And during their lunch break, we used to have major engagement. What is on your plate, you know? How colorful is your box, etc. So that really helped. And some of the staff members have this habit of drinking tea immediately after having their meals. So there are some barriers also for nutrition uptake. And this was a project which was financed by one of the multinational companies. Mm-hmm. And there was another project which was on NutriGarden.
Yep.
One of the
Could you just, sorry, can you maybe keep the example brief so we
yes,
can...
so the NutriGarden project is that you sow from farm to fork where the students are involved in growing, processing, and also consuming. So there we were looking at the microgreens and we were looking at vertical gardens, because in urban settings you don't have to have space to grow that. So through this also we worked with the food bank, and they were the financiers for this. So thank you for the opportunity.
Thanks for that sharing. We might quickly go online. We have colleagues from Gain India online, and just maybe in that second question about partners working together to make that happen, I'm wondering, Suprit, who's the country director for Gain India, if you want to give a very quick either reflection or a question for the panel on that, if you're able to hear us and able to join. And for
Hi, I hope I am audible.
Yes, you are. We can hear you.
Hi, very great to be part of this eminent panelist, and thank you so much for having me here. So I'm representing country India, where you know that we not only have the issue for the food security of the most populous country in the world, but also we need to make the balance for climate in our integration. So for that, we have a couple of programs and policies in place to make a correct balance between both of these. And to taking this work forward, as just mentioned, that we are doing an ICANN India version for this, although it's a very new area for us, and we are trying to explore that how we need to go into in depth of a few states in India and how this can be translated into actionable points. Now I hand over to Drishti to take this forward. Drishti, please be very brief on this.
Right. So what we're looking to do with the ICANN project in India is that we're first doing a baseline assessment of where is it that we stand as a country in terms of integrated climate action and nutrition. It's become even more clear that when we want to operate or function or have transformative action at the nexus of climate and nutrition, it is a multi-stakeholder approach is required. So, before we can actually talk about how can partners work together, we're rather identifying who are the partners and who are the key stakeholders from the government, the private sector, the non-profit organization, think tanks and academia, and looking at what is it that they're already doing in their respective domains, when it comes to nutrition, when it comes to climate, and when it comes to agriculture. In our country, in India, we see the major integration between climate and nutrition is happening at the agriculture point, right? We're an agrarian economy. So what we're doing right now is that we have very clearly mapped out various ministries and what falls under which ministry's ambit. So to have a very clear picture in terms of who are the stakeholders that we need to lobby with, or that we need to reach out to be able to, sort of get a more clearer understanding and to build upon the programs that are already existing. So this is what we're largely doing, and how we are looking to do that is, we're conducting, we're lobbying at state level by having workshops and meetings that serve as a dialogue platform for various stakeholders to come together and kind of express their views, because integrated action for climate and nutrition is a fairly new subject. So what we need to do is right now create awareness and sensitize various stakeholders on the importance of integrated action. Yeah, that's pretty much about what we're doing here at India.
Yeah, thanks. Thank you so much for that example. Did you want to just quickly wrap up, Dr. Suprit?
No, thank you. I think Drishti has summed it up well. So yeah, over to you.
Thank you, and thanks so much for coming in and providing an example of how this global process and analysis that we're doing is also reflected and can be applied at national level. I'm just wondering if there's any last question from the floor, and then I'll hand back to our panel both to maybe respond to anything that you've heard, and then maybe share a final reflection as well. So maybe one more from the floor, if there's any last burning question for the panel. It seems like we're good. So I'll hand back to the panel now, maybe to reflect on something that you've heard and then share your final takeaway for the from the session. So thanks. Regina, did you want to start?
Thank you. I have, just want to add that there's other partnership activities to address nutrition in PNG, and that is between World Bank, that's on child nutrition and social protection project, that is ongoing now, and there's also Australian government support to reduce childhood stunting in PNG. Just recently, the European Union funded a project on forestry, climate change, and biodiversity. And the main implementers are really the Environment and Conservation Authority or Agency, the Forestry Authority, and the Climate Change Development Agency, those three agencies of the government, but they've just included, like livelihood activities under the forest, so the rural people, they do need to eat to survive, so they can't just live on forestries, and they have invited the Agriculture Department to to contribute, and we have yet to contribute and to design, and at this, it would be what we will contribute to would be more of agriculture, nutrition sensitive agriculture interventions, and involvement of women and gender inclusion in those activities. I also just picked up something which really, for PNG, we tried after our national policy to initiate, and that would be a main coordinating agency at the high level. We wondered if we could park that committee or council at the Prime Minister and NEC level, but it didn't work out. We didn't, get a traction on that one, so we then decided to park it under the Department of National Planning and Monitoring, just simply because they were more central agency, government agency, and they would coordinate that program, nutrition program well, but that also didn't work out in the first 2 years. So it's back to the Department of Health. But it would be good to learn from Philippines' experience that Madam has just mentioned on the Council of Nutrition. Would be really good for PNG to learn some of those from Philippines. Thank you.
Thanks. I might pass to Dr. Shin next, and then we'll go to Cherry, and then Dr. Appet to close. So thank you.
I would like to quickly just share some my own view, about our Vietnamese representatives' question. Yes, there is this demand and supply size for this nutrition, and there is also this the willingness for government to prioritize the targeting of the poorest and poor population, because they are the most suffering from the lack of food, food insecurity and climate change. So, for example, right now in Pakistan, this dynamic National Social Economic Registry, those data will be shared from BISP to the provincial governments, and they will reach MOU. That's also under our ADB's dialogue. We want to convince that provincial government would be willing to take this as their target when they are planning their supply side capacity and service delivery. So, which means this data set is about this measurement and mapping of the poorest households in all the districts. And then government side, provincial government side, because they are under federal system, so social service deliveries are all under provincial level. They are different from federal level. So provincial level shall plan their supply side capacity, like building up hospitals, hiring enough health workers, and also like water and sanitation, all this intervention, if they are willing like to focus on prioritizing those targeted poorest population. Yeah, I stop here. Thank you.
Thank you.
Yeah, I think I would like to share on our experience lately doing advisory with the local government unit. I have this one mayor, we work with him. He increased the agriculture budget for 20%. The health agency complained, the environment agency complained. And then I asked the mayor, ask them why they complained. You know, because they feel that the agriculture sector should always have the lowest budget, 1% of their municipal or city budget. And then we said, because they're complaining, how do we harmonize so that we have a harmonized effort from the environment side, the health side, which caters to your nutrition programs, and then your agriculture side that caters to your food security. So this harmonization is very exciting. We hope SAN's ego is existing, because sometimes when ego is there, different agencies are competing, right? So with the mayor's leadership, we're really doing well, because the mayor said, nutrition is our priority. We're not even talking about productivity anymore for agriculture. We're talking about nutrition of every constituent of our city. So that's our vision. So how do you contribute to this? So I think I will pose this question to you, if you're from the government, if you're from the private sector or civil society organizations. How do we harmonize all of these agencies? Because these agencies are actually acting so much in terms of local application of national plans and global plans. And these agencies are also managing so much funds that if they are planned accordingly, we can definitely meet our objectives on nutrition, climate, and harmonization of food systems. Thank you.
Thank you. Can I just ask which municipality that is?
This is in Victoria City, in Negros Occidental. They just won the award for the Sustainable the Governance and Leadership Award in the Philippines last year.
Great, thank you.
Thank you very much. Actually, intersection between food system, climate, and nutrition is really very crucial. And actually, it presents both opportunities and challenges. In the Philippines, we have really a triple burden on malnutrition. We have undernutrition, exemplified by stunting. We have high prevalence of stunting, especially among our under 5-year-old children. And then second, we have wasting, but we are on target of achieving it at the SDG level. And at the same time, we have the second form, which is overnutrition, which is obesity and overweight. Very rampant. 40% of adult population we have in the country are overweight and obese. So, and lastly, we have micronutrient deficiencies disorder. This is the reason why that we are proposing, really pushing hard for food fortification and the addition of folic acid into our wheat flour so that we can have to prevent neural tube defects. And opportunities, with all this, the opportunities are coming in. Late last year, the Philippine government, through the National Economic Development Authority, crafted the framework on program convergence budgeting. And what is this? This is an approach which aims to focus on government resources to target on key programs and projects of government that shall be initiated and implemented by departments and agencies across the country at the national level, and with a holistic approach, convergent approach, so that these resources will be maximized. And with this, next week, we will be convening again the Interagency Task Force on Zero Hunger, wherein these national government agencies will be able to come up with their sound budget proposal for nutrition. So the Interagency Task Force on Zero Hunger, wherein the Department Secretary of the DSWD, or the Department of Social Welfare and Development, is the chair, and I'm the co-chair. So we are convening the interagency group composed of 36 national government agencies and agencies, sub-agencies, really to come up with convergence program so that for 2025 we can have budget that is really adequate for nutrition. So how adequate is adequate? That's a problem. That's a challenge. Where in one country cannot even say what's adequate for money, for nutrition and value for nutrition. So this is now the opportunity for our development partners, our international cooperators like donors, the development partners, the UN agencies we have here in the Philippines. This is high time for them to engage with government, to come up with programs and projects, help government really put up some money, financial as well as technical assistance, so that the Philippine Plan of Action for Nutrition will be able to be implemented with the objective of really attaining the Sustainable Development Goals. We're in Sustainable Development Goal number 2, which is zero hunger, improve nutrition, improve sustainable agriculture, is really lagging behind in the country. And I'm thankful to PNG here for really recognizing the fact that NNC in the Philippines, which is 50 years old already. So we will be celebrating our 50th anniversary this coming June 24, and hopefully we can have on a higher position in the country. So we are attached to the Ministry of Health, but before, years before we were created, we were supposed to be under the Office of the President. But years later, we were transferred to the Department of Social Welfare, to the Department of Agriculture, and now to the Department of Health. So the question is, are we gonna stay this way? So you are welcome. In fact, the Tajikistan team will be coming over to Manila to visit the National Nutrition Council, and they will also be replicating the National Nutrition Council office, the secretariat that advises the NNC Governing Board for sound policies towards nutrition-related activities. So my takeaway is investment in nutrition is good governance, and good governance is good nutrition. So for all our local government units, the challenge is the non-prioritization of nutrition program in their localities, partly because they have low income. Second is they really do not like nutrition, because nutrition is not seen. No? They can see the buildings, the basketball courts, and other infrastructures. But nutrition, they cannot see it. But as I say, if you can have good citizens, productive citizens in the near future, then you have good governance. So invest in nutrition. Thank you.
And I don't think I could have summed it up any more perfectly than that. So I'll just, first of all, thank Kazuko from ADB for all the assistance organizing this panel. Also thank the great technical teams for keeping us all running smoothly. And finally, a final round of applause to our panelists. Thank you so much. We really appreciate it. And now I wish you all bon appetit. Enjoy your lunch. And I'll just invite Irina back here to take a photograph with the panelists. Thank you all. Enjoy your lunch.